School starting very soon. Parents want to know how to keep them safe. Kids at least 12 years old are eligible to get their COVID-19 vaccine before school starts. Our medical expert, Dr. Samir Islam, is here to answer some of our questions for us today. Dr. Islam, thank you so much for being here once again. Let's talk about this Delta variant impacting kids. Is it impacting kids more than the past variants of COVID-19?
Oh yeah, 100%. We are seeing the vast majority of people who are getting sick and getting admitted to be younger individuals. This Delta variant is really selective to those who who didn't have the risk factors before, who are younger and who have not been vaccinated.
Okay, that is a worrisome thing to hear, especially for parents too. So what advice do you have for parents right now?
It's really simple. We know that the science is clear. If you get vaccinated, that substantially protects you, your children, and your loved ones from getting the vaccine. And if you choose to not get vaccinated, do the things that would keep you protected, wear a mask, try and do social distancing, but by far the most effective thing you can do is to get vaccinated for you and your children.
Okay, and Dr. Islam, schools aren't able to mandate that kids wear masks. So what do you recommend for kids, especially those who aren't or can't be vaccinated? You said the masks. Is that something you recommend going into the school year?
It's a very good question. And so the CDC has recommended for some individuals to wear masks inside. Now, I know there are certain reasons why we can't do that. But if you can't do that, please make sure if you're an adult, you get vaccinated, because that way it can protect you from getting the virus and also protect your loved ones who actually may be more at risk for having disease. Washing hands, closing your mouth whenever you cough, these simple measures will make a tremendous difference to make sure you and your loved one and your children don't get sick.
And earlier today, we just mentioned it too, Dr. Wells, or Ms. Wells was saying that 132,000 people in Lubbock County are eligible to get the vaccine, but they haven't. What needs to happen for these other people to get vaccinated who haven't got vaccinated yet?
The thing we worry about is, are we going to have the same thing that happened last year? It's almost like Groundhog Day. The same type of disease is happening, but more severe and in people who are younger, who didn't have the risk factors before. We have vaccines. It's tax-free weekend, just like you mentioned. Go shopping, save some money, get your vaccine. It's a great combination. If you get vaccinated, I can almost guarantee you the rise of the virus will go away. We can go back to having a normal, everyday life.
And normal is definitely what we want. Recently, research also found it safe for pregnant women to get the vaccine and also women who are breastfeeding. Do you agree with that?
On 100%, the data is very clear. The science is there. If you're pregnant, if you're breastfeeding, the vaccine is safe, and that should not be a reason for you to be worried to get the vaccine at all.
Okay, Dr. Islam, thank you so much for being here with us. We really appreciate you all the time. Thank you.
Thank you, guys. Appreciate it.